Specialties. My name is Katrina again. I'm with Neighborhood Legal Services of Los Angeles, or NLSLA. I'm a senior attorney with the Medical Legal Community Partnerships, and we're going to go over some health benefits. Okay, so plan. I might have to speed through some of the slides, but hope to cover everything. And I did get some of the questions from the social work team. I'll definitely be covering those. So first, we'll go over the Affordable Care Act and the coverage continuum model and how that's laid out. Going to go over Medi-Cal, which is California's versions of Medicaid, Medicare, Cover California, COBRA, and fertility preservation. So this is what the framework is now for health coverage after the Affordable Care Act. Um, Depending on one's income, you might qualify for Medi-Cal. If you're above a certain point, you might go into Cover California. And then there are various programs in between, such as special programs for kids where they can be enrolled into Medi-Cal if their parents' incomes are a little bit higher. And then the other levels kind of determine how much financial assistance you get from Covered California. So this is the income chart for 2024. DHCS hasn't really released its own um, federal poverty limit or FPL levels yet, so they might be updating this. But for now, this is what it looks like. I've highlighted the 138% FPL column because this kind of determines whether or not you qualify for Medi-Cal as an adult. And so that's approximately 1732 a month for a household of one, or for a household of four. If the income is below 3,580, they can possibly qualify for Medi-Cal. So if you are familiar with the Medi-Cal program, you might have patients that have it. These are the cards that sometimes they'll get for their services. The newer card is the one with the poppies. So we've seen that more often, but I think there are still some clients that have the blue and white card, especially if they got it back in the day. As far as income levels, like I mentioned, if you're an adult, you'll qualify for Medi-Cal if you're below 138% of the federal poverty limit. If you have children and they want to retain their Medi-Cal coverage, the parents can still enroll them in Medi-Cal for kids if their income is up to 266% of the FPL. And then that usually comes with a premium, like $30 or so a month for the children to have Medi-Cal coverage. Before the Affordable Care Act, Medi-Cal was limited to certain populations. Maybe some people were familiar with this framework if they were practicing before. You really would only qualify for Medi-Cal if you had children, if only children would really qualify, or parents of dependent minor children or disabled individuals. After the Affordable Care Act was implemented in 2014, they expanded Medi-Cal to individuals 19 through 64, as long as they qualified um, uh, under citizenship or immigration status requirements, and as long as they were below 138% of the FPL. Um, since that time, California has opted to expand full scope coverage to certain immigrant populations. Starting in January 2020, they did the young adult extension to adults 19 through 26, regardless of immigration status. Maybe you all saw that change with some patients that were coming to you. And then in May 2020, there was this Health for All Seniors expansion where they allowed adults over 50 to get full scope Medi-Cal regardless of immigration status. And then as of this year, January 1st, 2024, the SB 184 expansion allowed adults 26 through 49 to qualify for full scope Medi-Cal regardless of immigration status. So if you all have had immigrant patients, maybe you've seen some with restricted scope or emergency coverage, and that's usually due to them not having qualifying immigration status. But now that SB 184 is in place, that shouldn't be an issue. If they have the qualifying income, they should be able to get full scope Medi-Cal benefits. This is a little more on the more recent SB 184 expansion that took place January 1st of this year. It removed immigration status requirements if California resident was income eligible for Medi-Cal. And if they were already in the restricted scope or emergency Medi-Cal, they were automatically enrolled into full scope benefits. They didn't really have to do anything. They should have gotten some notices in November of last year about this change. Maybe some didn't get that notice. And then ultimately they'd have to choose a managed care plan because with restricted scope, you were really getting limited emergency services. Now with full scope Medi-Cal, they could enroll in a health plan like LA Care or HealthNet and access other benefits like primary care services, mental health services, things of that nature. If someone wasn't already enrolled into Medi-Cal by the time SB 184 was enacted, they would need to enroll and then assuming that they qualify income-wise, they should be able to get full scope benefits. So for Medi-Cal, you have to be a California resident, someone who is residing here or intends to reside here permanently. And then, like I mentioned, if you're an adult, you generally have to be below 138% of the FPL. Um, if there are other special programs, like I mentioned earlier, the Medi-Cal for Kids program, there's also pregnancy Medi-Cal. And then if you're a disabled individual, you're going to be in what's called non-Magi Medi-Cal. And you can maybe qualify for sh share of cost-free Medi-Cal under the Working Disabled program. And just to clarify, MAGI stands for Modified Adjusted Gross Income. That's like the line on your tax form. And they basically base your income levels on that number. Um, and then if you are 65 years old or disabled, there used to be an asset test, but they just lifted that as of January 1st of this year as well. If you have patients that need to apply for Medi-Cal, there's a couple ways to do that. There is this Benefits Cal website. That's what it looks like on the right-hand side. They can go to their local DPSS field office, or they can try applying through Covered California or calling in. And once they do enroll and get onto Medi-Cal, they're supposed to choose a managed care plan or an HMO like LA Care or HealthNet. Otherwise, they'll be defaulted into a plan after 90 days. So Medi-Cal is supposed to be comprehensive. It includes any medically necessary services, dental, vision, long-term care programs. There's also special programs within Medi-Cal that maybe not a lot of people are aware of. There's early periodic screening, diagnosis, and treatment. Those are for usually individuals up to age 26, I believe. If they need certain screening services, there should be expanded um, services available through EPSDT. If you need assistance with activities of daily living, like cooking, cleaning, and you're a disabled individual, you can get in-home supportive services or IHSS. And then there's also transportation services. You can get non-emergency medical transportation or non-medical transportation through your Medi-Cal plan. So IHSS, like I mentioned earlier, is for full scope Medi-Cal beneficiaries with disabilities or over 65, and it provides them personal care services so that they can reside at home instead of getting sent to a nursing home or another facility. Includes domestic services, self-care, paramedical services, transportation, mobility services. And then it should be covered if they have no share of cost, full scope Medi-Cal. Um, and usually there will be an evaluation process by a social worker with the IHS program. They'll come into the patient's home and see what their needs are, and then that will determine the amount of hours that they're going to award to the beneficiary. So as far as transportation services, if there is a patient that needs some sort of specialized transport because of their physical disabilities, like a wheelchair, they can possibly get that covered through Medi-Cal. They would probably need a doctor to prescribe the rides in advance. With the various details about the time of day, whether or not it's a weekly treatment, what type of vehicle they need, and it's supposed to provide safe, reliable transport and door-to-door service from the patient's home to the hospital. Um, and then there's also non-medical transportation or NMT. So if a beneficiary can use like a Lyft or an Uber and they need a ride to the doctor, they should be able to arrange that through their managed care plan. It's going to take probably less authorization than NEMT, but they should still plan on calling in advance to arrange transport. Um, so this is just something I left in here in case you have clients or patients that want to maintain fee for service or straight Medi-Cal. Sometimes some patients will see providers that don't accept a managed care plan like LA Care or HealthNet, and they want to stay within straight Medi-Cal. There's unfortunately a process to stay within straight Medi-Cal. The idea is that most Medi-Cal members or beneficiaries will be in managed care services. So it's a very rare circumstance where they'll allow a patient to stay in straight Medi-Cal. It has to be filled out every year, this medical exemption request, and it requires their fee for stay within straight Medi-Cal services. And usually it's for patients that have some sort of specialized treatment or complex disabilities, and they need to continue access with the straight Medi-Cal provider. And we also ended up suing the county over this process, and so it's improved a bit. Before they weren't really using medical consultants to review the MERS. It was just kind of administrative. So that's improved. And now at least the MERS will be a little more expeditious. Okay. So this question was brought up, I think, by one of the social work team. As far as like property and whether or not that's recoverable by the state. There are certain regulations and restrictions on that on as far as Medi-Cal or state recovery. And then I included the link there for people that want to see that on, it'll be in the slides I sent to Shu. But basically, there's really limited circumstances where the state can make a claim on the beneficiary if they've used Medi-Cal services. The most common one is if the beneficiary was over 55 and received Medi-Cal benefits for the following nursing facility services or certain home and community-based services, not IHSS, but very specialized programs like intermediate care for disabled individuals, waiver programs like the assisted living waiver, um, and then hospital and prescription drug services provided to an individual that's either nursing facility services or those specialized home and community-based care services I mentioned. So it's very limited. So if you were using Medi-Cal before you were 55, those services aren't going to be recovered later on. It really only applies after you're 55. Unless like you were permanently institutionalized in a nursing facility or an intermediate care facility, that can come at any time. And then the other key thing is the estate recovery doesn't really apply to someone's estate if they don't have anything subject to probate. So if they don't pass with anything in their name, or they put things in a irrevocable living trust, in an irrevocable trust, then it's not going to be subject to probate law and therefore not recoverable. So like I said, it's very limited circumstances where Medi-Cal estate recovery will come into play. Before the changes, it was a little more broad, but now they've narrowed it down to these very specific categories and circumstances. Okay, before I move on, I don't know if there's questions on Medi-Cal. Okay, if not, let me go to Medicare. So Medicare is generally available to people 65 or older or people with disabilities. So if you have a disability and you're under 65, you do have to be on what's called Social Security Disability Insurance for at least 24 months before you'll qualify for the Medicare. Sometimes there are patients that are under the impression that they can qualify for Medicare if they're on SSI, but unfortunately that's not the case. You have to be on SSDI specifically. The key difference between SSI and SSDI is that you generally need 40 work credits, or that's about 10 years of income reported to Social Security in order to qualify for SSDI. Medicare does help with the cost of care, but doesn't cover all medical expenses. I'll go over that in the next few slides, or the cost of most long-term care. And then if you are a patient that's eligible for both Medicare or Medi-Cal, without a share of cost, you can qualify for additional cost-saving benefits. Okay, so if you happen to have a patient that's dual eligible, or what people call Medi-Medi in some circumstances, that means they're receiving coverage under both Medicare and Medi-Cal. In order to qualify for Medi-Cal, you have to have limited income, like I mentioned earlier, generally under 138% FPL. And it used to have an asset test, but since they've eliminated that as of this year, that's not applicable anymore. Um, and then Medi-Cal is kind of like the payer of last resort and can cover certain services, but the primary insurance that's going to be billed will be Medicare. Um, Medi-Cal can kick in if there's like certain premiums or cost sharing that's not covered by Medicare. And then it can also provide NEMT or NMT and durable medical equipment. Um, that might not be covered by Medicare. And currently, seniors that need drug benefits are now required to enroll in Part D. Before, they used to be able to just get Medi-Cal coverage, but now they have to enroll in Part D. And then that kind of like, determines like the formulary and how much coverage you get for a certain medication. If someone has private insurance and Medi-Cal, they'll just have to be careful that there are no disconnects between their providers. So, for example, if they see like someone under Anthem, Medicare, they'll have to just be sure that their Medi-Cal provider lines up, or their Medi-Cal coverage lines up with that provider. So if you haven't seen it before, this is what the Medicare card looks like. It usually lists the parts that they have for Medicare. Part A is the hospital insurance, like inpatient care, skilled nursing facility care, hospice care, home health care. And Part B is the medical insurance portion. So if someone needs to see their doctor outside the hospital or get outpatient care, um, that's under Part B. And then Part D, like I said, if people need drug benefits, they'll need to enroll into that, and it'll help cover the cost of drugs. There are certain work requirements as far as qualifying for different parts of Medicare. You get free Part A if you're 65 or older and you have worked and paid Medicare taxes for at least 10 years, generally like the 40 credits. If you didn't pay into Medicare while you worked and they're over 65, you could be able to buy Part A. And then as far as Part B, everyone has to pay for that. The monthly premium right now, I think, is around 174 or something. And that's generally deducted from their retirement. Unless they're Medi-Medi, they can qualify for certain cost sharing programs that will pay for that Part B premium. As far as options, maybe you have some patients that prefer original or straight Medicare. That includes Part A and Part B. They can also join Part D if they want drug coverage. And then if they want assistance with like other charges like co-pays, co-insurance, vision or dental that's not generally covered, they might want to get supplemental coverage for that. I guess the one of the benefits of original Medicare is that they can go to any doctor or hospital that takes Medicare anywhere in the US. It's very portable. So if like a patient goes and sees family in another county, that might be a reason why they prefer to stay on straight Medicare. The other option is to enroll in Medicare Advantage, or what's also known as Part C. It's basically like a Medicare HMO. It's all in one. It can be like a bundled plan that includes Part A, Part B, and Part D. It might have lower out-of-pocket costs than original Medicare or straight Medicare. The problem is maybe for some patients, they'll need to use doctors within that Advantage Plan's care network. But one of the benefits is that it can cover other things that straight Medicare doesn't cover, like vision, hearing, and dental services. So it's kind of up to the patient as to whether or not they opt to stay in straight Medicare or enroll in Part C, depending on their needs. Okay, any questions on Medicare before I move on? Okay. All right, covered California. This is something that was developed after the Affordable Care Act, um, or I guess also known as Obamacare. Covered California is California's version of the federal exchange. So if you lived in another state, you might have had to gone through the federal marketplace, but in California, if you need to get insurance outside of Medi-Cal or your employer's insurance, you can go through the Covered California exchange. Um, it's supposed to offer full health insurance coverage. And depending on your income, you may qualify for certain cost sharing reductions or CSRs and or monthly insurance premium assistance or advanced premium tax credits, APTCs. Um, if you are an individual or a family living in California and your income is too high for Medi-Cal, you'll generally go into the Covered California marketplace. Or if you don't have affordable insurance through your work and you meet the immigration and the income requirements, you can also go through Covered California. Unfortunately, they undocumented or DACA individuals can't use the California exchange. Um, Strangely enough, you can enroll into Covered California if you have a tourist visa or a student or a work visa, but you generally probably won't qualify for the premium assistance. And then as far as enrollment, the enrollment period is generally November 1st through January 31st, unless you have a what's called a special enrollment period, which I'll go over later on. Okay, so we're back at this coverage continuum model. So whereas earlier we were in this Medi-Cal area, we're now looking at Covered California, which is generally for individuals 138% FPL above. Except if you're a child, then you can still qualify for Medi-Cal over here. But generally, there is premium assistance up to 600% of the FPL. And then as far as like the plans, they kind of use these metal tiers to separate the plans depending on patients' needs. So if you're enrolled like a bronze plan, those are more like catastrophic type plans. There's low monthly premiums but very high deductibles for services. The silver plan is like kind of the medium, um, uh, usually recommended to patients. And there's also enhanced silver. So low, higher premiums, but deductibles not as high. And then if you have like chronic health needs or specialized service needs, someone might opt to go into a gold or premium or platinum plan, which have very high premiums, but minimal deductibles, and maybe coverage for other services. They offer HMOs, PPOs, or EPOs through Covered California. Unfortunately, you'll have to stay within some sort of managed care network if you go into Covered California. So that's just something to keep in mind. Okay, so as far as premiums, everyone has to pay something. Dancing dollar. I don't know. There. And then depending on your income, like I said, they will determine your premium level and how much premium assistance you'll be getting. You have to meet the immigration requirements, like I said earlier, and you have to agree to file a tax return if you want to try and get the advanced premium tax credits or cost sharing reductions through Covered California. Okay, as far as APTCs, you can qualify if you're 139 through 600% of the FPL. And an APT is it can be either a monthly reduction or a lump sum at tax filing. And then you also have to make sure you don't have any other offer of minimum essential coverage that's affordable or of minimum value. So for example, if you have like an employee or if you have an employer and their health plan is more expensive than like an enhanced silver plan, you can maybe possibly opt for Cover California instead. And then as far as like cost sharing reductions, so that's like assistance with like co-pays, co-insurance. You only qualify for that through Cover California if you're 139 through 250% of the FPL. And that's only available if you enroll into an enhanced silver plan through Cover California. Okay, so like I said, in order to qualify for APTCs, you have to meet immigration requirements, follow within the income requirements, make sure you don't have any other offer of minimal essential coverage that's affordable, and agree to file a tax return, and obviously purchase a plan for Cover California. Okay, any questions on Cover California?
Katrina, I do have a question.
Sure,
One of the slides mentioned someone with the tourist visa can purchase covered California, right?
they could,
Yeah.
possibly.
Then next one says then you have to file taxes.
Well, that's the thing. If you're going to purchase coverage through Covered California and you have like a tourist visa, you won't qualify for premium assistance. And that's what you need. You need to file taxes in order to qualify for premium assistance. So if you're just purchasing straight through Covered California, you're going to pay the premiums without assistance, then you wouldn't necessarily need a tax return.
Thank
Right.
you.
Yeah. So the tax return is only really required if you're trying to get APTCs or CSRs. Any other questions? Um, so moving on. So there is also COBRA. Um, if you are losing coverage due to like termination from work, you can opt to possibly get into COBRA, or if there's some other change in circumstances, your beneficiaries could continue on with the plan that they had before through COBRA. Um, so it would really only qualify, it would only apply if, your group health plan was covered by COBRA. A lot of employer plans are COBRA eligible, and a qualifying event occurred, such as a termination or death of the beneficiary, and you were a qualified beneficiary for that qualifying event. I'll go over that in the next slide. And then in order to enroll, you have to do that within 60 days of receiving notice of eligibility for COBRA from the employer. Okay, so this is a summary of qualifying events, qualified beneficiaries, and maximum periods of continuation coverage. So as far as termination, the employee could enroll into COBRA and continue their health plans, assuming that they were terminated for reasons other than gross misconduct, or um, so like a layoff, reductions in hours of employment, that'd be fine. The employee could enroll in COBRA if they wanted to. Their spouse could also enroll in COBRA, or their dependent children can also enroll through COBRA. It generally runs for 18 months, but I'll go over possible extensions through Cal COBRA. Um, if an employer enrolled in Medicare, maybe their spouse or the dependent child, they want to continue with the plan that they had with their employer instead, and they can also do that through COBRA. And then same for like instances of divorce or legal separation or death of the employee, or um, things like that. So very special circumstances where COBRA will apply. And then in addition to federal COBRA, there's Cal COBRA, and that provides COBRA equivalent protections to small employers within California. So it's usually 2 through 19 workers. And might also be available if someone exhausts their federal COBRA benefits. So if they reach like the 18 months, they can possibly extend it through Cal COBRA. And then below is more, are there more links on COBRA, if that you want to take a look at that. Any questions on COBRA? Okay, so This is also a question, I think, from the social work team, as far as like insurance options after losing employment. So like I mentioned, there's COBRA. You can also enroll through Cover California in during a special enrollment period or possibly qualify for Medi-Cal. So let me go over each of those areas. Okay. So like I said earlier, if someone's terminated from work for reasons other than um, wrongful misconduct, things like that, they can enroll in COBRA and keep their same plan under their employer, but they have to do that within 60 days of the notice of eligibility for COBRA from the employer. And they also have to pay their first premium 40 days after they send in their enrollment form, 45 days, sorry. And then, like I mentioned earlier, if the federal COBRA period ends, they can possibly buy another 18 months of coverage under Cal COBRA. The feedback I've heard anecdotally about COBRA is that the premiums are quite high. So I don't know if that's something people would be interested in extending, but it's an option through Cal COBRA. Okay. So like I mentioned earlier, Cover California, they have that open enrollment period, generally November 30 through January 31st. Sorry, November 1st through January 31st. But if they experience a qualifying life event, like involuntary loss of health insurance due to job loss, they can enroll through Cover California through the special enrollment period or SEP. And that can be like whenever this qualifying life event happens. If they want to opt for Cover California, they have to have enrolled through the SEP within 60 days of the qualifying life event or job loss. And they must enroll by the 15th of the month if they want their effective date to be the first of the next month. Otherwise, if they enroll after the 15th of the month, it'll start the next month after that. Okay. Um, Another option for insurance after losing employment is Medi-Cal. If someone has absolutely no income, they can possibly apply for Medi-Cal through the county. You generally have to go through LA County DPSS, Public Social Services. They'll probably need proof that their income is below the allowable income limit, and they look at that at a monthly basis. Um, so maybe pay stubs or the last place they have, maybe bank accounts will be asked for. And then DPSS usually processes the applications within 30 through 45 days, unless there's like some sort of emergency circumstances, you might be able to get onto Medi-Cal faster. Okay, any questions on this section before I move on? Not. Okay, another question from the social work team, authorization requests for medical services. Um, if depending on the insurance plan, especially if they're a managed care plan, there will be authorization requests requirements for certain services. And then those treatment authorization requests, they have to be completed by the patient's treating provider, and they have to justify why that service is necessary. Um, and then there could be some delays if there's confusion over like what paperwork to fill out or whether or not like the justifications are sufficient for the plan's purposes. That can be kind of a struggle for a lot of patients and doctors. That's understandable. Just the bureaucracy of insurance is quite complicated. So there obviously could be delays as far as getting those TARs or treatment authorization requests authorized. There are some potential options if there are issues with the treatment authorization requests. You could try doing care coordination through the managed care plan. So for example, if a patient has LA Care or Anthem, they can maybe contact the care coordination team through the plan and see if they can figure out like whether or not a service can be authorized. Maybe they can like go over step by step with the patient what's needed to get authorization for those services, or maybe they'll be able to direct the patient to something else within the plan um, that can be covered. If care coordination doesn't work out, you could also file a grievance with the plan, and they generally have to decide those grievances within 30 days. Um, if that doesn't work out, they can escalate it, assuming it's a managed care plan, to the Department of Managed Healthcare complaint, or potentially an independent medical review through the Department of Managed Healthcare. So the DMHC complaint is generally for denials of certain services, independent medical review also for denials of services, but if you like needed certain equipment, that's also through the IMR process. But either way, there's like one um, form to fill out for DMHC, and they'll decide whether or not it's a complaint or an IMR. And generally, you need to have gone through the health plan grievance before you can escalate it to DMHC. Unless it's like an emergency situation, you can bypass the plan grievance and just file a complaint with DMHC directly. Um, a lot of DMHC complaints are favorable to patients. So if they aren't getting anywhere as far as like the plan, and it's something that's medically necessary, then they might want to consider a DMHC complaint or an IMR. The other option, as far as authorization denials, is a state fair hearing through the county. But there could be delays in scheduling the hearing, especially after COVID. Like I think the administrative law judges' calendars have been kind of packed. So it could take a few months for a state fair hearing to happen. So generally, we try to resolve the issue before it gets to that point, or go through DMHC, but a state fair hearing is also an option. That has to be filed within 90 days of the denial notice. Any questions on authorization requests? All right. Okay. So last section, fertility preservation. I don't know if you all are familiar with this, but um, infertility can be caused by medical treatments for cancer. So it's something that's a very niche population, but it's something that we're trying to get insurance to cover on a more expedited basis. Right now, it's been kind of difficult, as I'll mention in the later slides. Um, so young patients maybe need to undergo cancer treatments, radiation or chemo, and um, I mean, along with other things they have to consider, as far as family planning, if they want to have their own children, they might want to consider doing fertility preservation. So like storage of reproductive material or collection. And sometimes that's not really something that the insurance will cover. Um, there have been some expansions in this area. Um, so in 2020, there was a Senate Bill 600 that confirmed that fertility preservation should be covered by most health insurance carriers, um, especially those governed by DMHC, Department of Managed Healthcare, and California Department of Insurance, or CDI. So that might apply to certain California plans or other managed care plans. Because without coverage from insurance, I don't know, the cost for like collection and storage can be quite difficult for people to pay for. So that's why people have been trying to push for insurance to cover fertility preservation on an expanded basis. That has kind of happened with some managed care plans that we've seen, but unfortunately, it's not really something that's available to Medi-Cal coverage right now. Um, Advocates are kind of looking at ways to justify more coverage for Medi-Cal patients especially. I mean, it's kind of an equity issue as to who gets access to fertility preservation, who doesn't. But right now, that's still carved out, unfortunately. Hopefully, maybe in the next few years, this will change. There are other states that actually provide Medicaid coverage for fertility preservation just because they justify that it's kind of a very niche population, like I said, that would access these services. But right now, California is not one of those states. Um, and the other thing is that if you have a self-insured plan, so those are plans outside of like the DMHC or CDI framework, those are also excluded from fertility preservation benefits. So still a evolving area. And then if there are further updates on that, we'll definitely keep you posted. Any questions on fertility preservation? All right. So this last slide, if there are patients you have that need assistance with health access issues, and they're residing within LA County, they can definitely contact our office's Health Consumer Center. We have a hotline, this number here. We also have a general hotline for patients that have non-health cases down here. And then you can also apply for services through our website, NLSLA.org. If they have a patient that's outside of LA County, so I know some patients are getting transported in from nearby counties like Kern or San Bernardino. They probably also have a health consumer center in their respective counties, and then they can find that out through the healthconsumer.org website, or they can call this number for that info. And then the HCC, they at least the one in our office, they have a lot of experience in health access advocacy. So if someone has like a TAR that's not getting approved and they need to do a grievance or file a complaint with DMHC, that's something we definitely have a lot of experience in. If they need representation at a state fair hearing, that's maybe something we can evaluate. If they are having issues accessing non-medical transportation services, or any Medi-Cal services in general, that's something we can definitely assist with, and medical exemption requests as well. And just generally understanding like insurance coverage, like fertility preservation, figuring out like whether or not the plan can cover that. We've filed grievances on behalf of individuals and complaints and who've been able to get some coverage on that. So that's something the HCC can cover. Um, okay. And then with that, I think, I don't know if there's any other last minute questions. And then, like I said, I will email the slides to Shu, and then I think that's going to be made available through a newsletter or something.